I'm filming again, Don.
Okay, so here we are working on closed chain knee flexion. So you saw me working with Medella on her back, getting the open chain knee flexion. It's important that you still improve knee flexion both in unloaded and loaded positions. Still have my trusty Windexter goniometer. And her motion staying around 90 to 95.
Come around so I can.
Just an opportunity for you to apply your anatomy, lateral malleolus, greater trochanter, middle of the knee joint. If you're interested in going to physical therapy school or any kind of clinical program that works with movement, you need to learn how to use this, get comfortable, hang out with your athletic training students if you don't get a chance to learn how to use this.
Could you maybe talk about also how a goniometer can help a personal trainer identify safe range of motion to work through with a client?
Sure. It's just a nice way to objectify motion of the joint. So, especially if you have someone who's post-rehab or they've been released by their medical provider to pursue fitness activities, and you know that they've got, let's say, a total shoulder replacement or total ankle, and you want to know how much motion they've got isolated-wise, so that when you put them in a pattern and load that pattern, you need to know where their safe limits of motion are. For those of you who have a weight training background, you know, for example, like a knee extension machine, it's going to have range of motion limitations on it. You know, some nicer machines do, and so you can set your machine based off of what's a safe range for them, based off of their medical history, injury history, pain problems. So using a goniometer just helps you to objectify that process more. And we are all about trying to be more objective with this process.
So to summarize that, you could just eyeball it and you could look at the way somebody moves and have a visual assessment of how much range of motion they have. But when you have a goniometer, you can actually put a number on it, which allows you to quantify change over time, and that overall is a more professional way to work with a client.
I'm speaking with students, I'm always talking about trying to find ways to expedite the process towards mastery. And I think one of the best ways to do that as a novice, as a new professional, is to measure everything you can. Because so experts, masters in their field, their pattern recognition is faster. They pick up things, they see things a lot quicker.
She's like, stop talking.
Keep going, Medella.
We're not done talking yet, Medella. Keep going.
And so
He's looking at me for help.
yeah, when you're new in a profession, I think you should measure everything to try to get more comfortable with what does a 90-degree knee flexion look like. What is 120? How much motion in the ankle is needed? And then you can start to you can eyeball more depending on your setting and your situation. That's good. Good work.